My name is Maria Hopson. I was initially born in Romania, but we moved to the United States and we've been in Omaha since I was 10, and I really like the area, so that's how I decided to pursue medical education here. I did my undergrad at UNL, my med school at UNMC, residency at UNMC, and I like it so much. I'm just here to stay for my jobs. When I was probably in high school and starting to think about what I wanted out of a job, I wanted something that would maximize what I could give back to society, while at the same time keeping me happy and interested. And so then I took a course in physiology, and I found that subject content to be more interesting than anything else I had previously learned about. So that steered me towards something medically related. And I tried out both research and kind of shadowing clinicians, and I preferred the clinical aspect of things. So that's what steered me towards being an MD rather than a medical researcher, for example. My specialty is internal medicine, so I deal in medical management of diseases in just non-pregnant adults. And there are a couple of different things you can do as an internist. I'm doing a hybrid model, so I'll be taking care of those patients both in hospitals and also in the clinic setting. And one of the things that I really appreciate about this specialty is that you really do get a lot of face time with your patients, particularly in the outpatient side of things. And I would say even inpatient setting, although you're only spending about 10 minutes, well, depending, 10 to 20 minutes a day at the patient bedside, it's still a lot more than you might get in other specialties. So the patient interaction and just seeing them over and over in the outpatient setting and really building a relationship with them is something that I appreciate about internal medicine. And then I also like just the intellectual aspect of it. A lot of the emphasis in internal medicine is problem solving and figuring out what the problem is and what the best solution for it is. I have two goals when I first sit down with a patient. So there's the medical aspect of things, and being in internal medicine, I treat a very wide variety of conditions, so that will depend on what you're coming to me with. But part of the interview will be based off of your medical problem, but then the other part when I first sit down with you is also just to get a basis of what your view of medicine is like, how much, some people say they don't like doctors, they're more minimalist in terms of pills, and it's a shared decision-making process. So, I'm not gonna force anything on my patients. You have to be on board with whatever we decide. And so being able to come up with a plan that works for you as a patient involves me diving into your beliefs about medicine, what your personality is like, what your goals are for life, those sorts of things. So part of it will be getting to know you as a person, and then obviously a lot of it will be based off of just getting to the root of what the medical problem is. Studying here, I was very much exposed to I think what it's like to be a very good teacher for residents and for the upcoming doctors. And I really appreciated my relationship with my mentors and the attendings here on staff, and I feel like they helped me grow exponentially. And you compare with people who've gone to other places that maybe don't have such a high academic presence, and I definitely like the way we do it here, and I'd like to be involved in maybe passing on some of this knowledge to the upcoming doctors and being involved in their education as well.